Hello, I'm Jeremy Fernandez and welcome to our special live stream to answer your questions about coronavirus. Joining me today is medical reporter Sophie Scott and GP Dr. Bret Mckay. Brad and Sophie, welcome to both of you. Good to see you.
Thank you.
Thank
Good
you.
to see you, Jeremy.
So now we're taking your questions on coronavirus, so leave them in the comments boxes below and we'll get to as many of them as we can. And to all of you who've written into us, either through the ABC News Online website or through our Facebook and YouTube channels, thank you so much. And many of these questions, Sophie and Brad, not too dissimilar to what we've seen, but as we've seen the advice changing and the science around coronavirus changing, it's worth putting some of these questions to you, to both of you again. So let's begin. Peter Chu, who writes to us on Facebook, asks this question: what's a suitable substitute for alcohol hand sanitizer if there's no access to a hand washing facility? So hand washing is out, alcohol is out. Is there another option there, Sophie?
Well, I have seen recipes for make your own hand sanitizers. I probably wouldn't do that without necessarily talking to an expert first. Brad, have you seen these recipes? It's basically you can order the ingredients on a website and then you can make it up yourself, basically. But because I know people are desperate to be getting hand sanitizers and it's absolutely impossible to buy.
Yeah, so that is the problem. If you can definitely get an alcohol or alcohol-based antiseptic that's over 60% alcohol, then that's going to be your priority. But if you're running out of that, I suppose you can use other ingredients if there's nothing else available. But you're needing to rinse your hands as much as you can, lather it up as much as you can. But yeah, I don't think that there's anything else that's going to be like 100% guaranteed, even if you're using the antiseptic with the alcohol-based gel. That's not a guarantee either, but it's doing the best with what we can.
And this is the thing, isn't it? Being really aware of where your hands are going is such a... I never realised. I know a lot of people
touch our face. Oh my
like
goodness!
this all the time.
I'm constantly going, don't do it, don't do it. But now, for the first time, we have to be aware of how much we're doing it.
Yeah. Now, we got this question in from through our website. Can you catch the virus off pets' fur? Now, we get a lot of these questions about surfaces because it's almost as if once you've cleaned your hands, you've washed them, 20, 30 seconds, you go to turn off the tap, you open the door, the bathroom door, you walk out, you kind of walk out of the house, you're constantly touching things, and there's this constant question we get: how long does the virus live for? Brad, are we getting any clarity on that yet?
Not quite yet. There's not a hell of a lot of research on that. I take my dog for a walk around the neighbourhood and I'm a little bit edgy about anybody else touching my dog's head. So I think a lot of people will just sort of start to distance a little bit, which is what we're advising people to do. But I think it will happen a little bit with pets. I think if somebody does come up and does scratch your dog's head, then I would probably not touch their head for a while. When you get home, give them a bit of a wash and a wipe down. But yeah, you don't need to cover them in alcohol. Yeah, it's just sort of like common sense. I think that the chance would be low. We know that you're much more likely to get it if you're in close personal contact with somebody else. We know that surfaces are a problem. But yeah, it's just being careful. There probably will be some transmission, but I think the likelihood is still relatively low.
Sophie, this is a related question through our website as well. Someone's written in, we inherently touch our heads and hair a lot and then lay on a pillow that's often very close to a partner. Does that mean we should be washing our hair daily before bed?
Oh, goodness, I hope not. That's just one more thing we have to keep clean. Look, I think it would really depend. If your partner has the virus, you'd probably need to take some extra precautions. If they don't, then you're probably okay. Just back to the pet question, there was a meme going around, because there was thought at one stage that a pet might have contracted coronavirus. That was then discounted, and there were all these memes going around saying, the WHO, who let the dogs out? But pets were fine, so that was quite funny. And there has been, just on how long it lasts on surfaces, there was a bit of research that came out this week showing that it can last in an aerosol for up to 3 hours, and on some surfaces, plastic and stainless steel, up to 2 to 3 days. So that's why the cleaning is so important.
Brad, this was something you raised last week about hard surfaces versus soft surfaces, that there might be a difference there?
Yeah, so it seems with, as you're saying, like cardboard, it only lasts alive there for a few hours compared to other harder surfaces like plastic or metal. So, so I'm just sort of like elaborating that a little bit and surmising that that your dog's fur is probably going to be a little bit more like cardboard than like hard plastic.
We're getting a lot of questions from our Facebook channel around multi-generational households. So where you've got young kids, people in the middle, and then elderly people, some of them with diseases at various generations. So Samantha Bark asks this question. I live with an elderly person who has lung disease. I work in a school and my daughter goes there as well. Should we not go to work or school as a precaution for our housemate? So as a precaution for this elderly person they live with, we use very high standards of hygiene. But what do you think? Any advice would be very helpful. That's from Samantha Bark on Facebook. Sophie?
Well, I would have thought, given that's an older person with a lung condition, that would put them at particular risk. It's difficult to know because it would be, what's likely to happen is that if kids are going to school or an adult's going out, they could bring the virus back into that household. So probably practicing some good social distancing, the 1.5 metres with that elderly person would make sense. I mean, there's no one in that household that has the virus, which is good, but probably just being a bit more careful because that elderly person is in a really high-risk category. Brad, what do you think?
Yeah, and I think the guidance with this is a little bit blurry, I suppose, at best. So what we're sort of thinking logically about this is that you would be able to intermingle with other people. You could then bring the virus back home and then potentially infect your older household member. So the issue is that, as we've been talking previously, is about 80% of people might have no symptoms or very mild symptoms. So you could certainly be harbouring it inside you and not be aware of it at all. So I think it's a little bit dangerous to go, oh yeah, everything's fine, I'm feeling well, nobody's got the virus. Like, you really don't know. So I would be advising, like, I'm very biased because I'm a doctor, I would be advising those people to, if they're wanting to protect their household members, from being really, really careful about intermingling with other people. If they are going outside and meeting others, then yeah, like, you are wanting that social distancing, and it is a problem if you're having a meal on the other side of the room or sleeping in different bedrooms to your partner. Like, there's all these other things that we can do from a social perspective for distancing at home.
Kate Norman asks a related question as well. We have a 95-year-old living with us. Hubby has come home from work with flu-like symptoms, yet he can't be tested because of the criteria. Sophie, how is this, so the question of the criteria of whether you get tested or not, whether there are enough testing kits to go around, how is that all playing out in the past week?
It's been a vexed question. There's certainly the demand for testing is way outstripping supply, so the government has ordered more tests. But the doctors I've been speaking to say even it'd be very, very hard to keep up with the people wanting it. And like that person writing in, they don't really meet the criteria, but you could argue that given they're living with someone who's at very high risk, that and I guess it's based on symptoms. If someone in that household started to develop symptoms, then you could argue maybe they should be tested. We looked at other countries around the world, like South Korea, where they've tested a lot of people and they've done really well in flattening the curve that we keep hearing about. So testing is really crucial. Brad, do you agree that you must have lots of people coming to you wanting tests that you say we actually can't do it?
Yeah, so I have many questions every day about it. At the moment, we are very scarce with our testing kits at present. There was an announcement earlier in the week saying that we were going to get about 100,000 tests from America on Tuesday night, and then it's sort of like been a bit of radio silence. I'm still waiting to sort of like see what's happening with that. But the whole issue is that even if we have those 100,000 tests, there's a bit of a glut at the pathology lab. So even if we have that supply, we're going to use it up very quickly. So we are trying to concentrate on the low-hanging fruit, so people that are fulfilling the criteria that we're following. So if you do have like aches and pains and a bit of a runny nose, then that could be much more likely to be influenza than coronavirus. But we're sort of saying, look, if you've got respiratory symptoms, don't go out in public. If you're coughing, stay at home, isolate as much as you can. And yeah, like if you've been around household members who have lung disease or heart disease or other problems, then just try and have that social distance as much as you can, but it is difficult within households.
Brad, what is it like for healthcare workers right now? We got this question through to our website, the ABC News website. Should a healthcare worker who lives with elderly parents keep going to work? It would be difficult to practice social distancing in a healthcare setting. Now, you sent us a picture during the week of yourself fully kitted up. You know, you look like you're about to step onto Mars with that kit, but it does really explain
Look at that.
the sort of precautions that you need to take. What is it like for people who are working in the healthcare sector right now?
Yeah, so at the moment, I look dashing, I'm sure.
You can pull it off, Brad.
Yeah, I did tuck in my collar after I took that picture, going, I don't want to get anything on my collar. And even people were like commenting online saying, oh, your neck's exposed. So we don't have like protective snoods that we could put around our necks. We have limited supplies of equipment, and we are going to be running out. We're meant to be using like new aprons and total new equipment for every patient that we see, but we just don't have the supplies for that. So some clinics are just wearing the same apron, changing gloves. This sort of seems to be this in-between measure, and just sort of like putting everybody in at the same time to like have COVID-19 clinics to swab people. We're altering the way that we're doing swabs. We're trying to get the results back and calling people as soon as we do get those results, so they know if they've got the infection or not, or as much as we can tell. But yeah, the problem that we're seeing overseas, particularly in the States, is that people are running out of personal protective equipment. So healthcare workers, they're not getting masks. They're now having to use bandanas or scarves around their faces, which just aren't really going to do much, particularly if you're working a long shift. So this is the problem that we're getting to. And
is that better than nothing? Is having a scarf, for instance, wrapped around your face better than not having anything at all?
Well, we'll wait for the science to come out, but I would say if somebody's coughing in your face, it's probably going to be more protective than nothing at all.
All right, we're getting a number of these questions about self-isolation, quarantining, social distancing, how that works. Someone writes to our website saying there's been no advice about personal services like barbers, hairdressers, manicurists and so on. I've been thinking ahead to my next haircut and thinking, do I just go the buzz cut and grow a beard out and just hope for the best?
Well,
Sophie,
I'm just glad I had my hair done, because I was thinking too, what am I going to do about it? I know that now for example, massage therapists have been told that they shouldn't be doing massages. That's been something that their peak body's has put out as a recommendation. But I guess I haven't seen anything official from like hairdresser organisations about what people should be doing. I would imagine that they would have to take precautions, like at least wear a mask.
Yeah.
Because, you know, that is close contact with someone for a prolonged period of time. So for their own safety, they need to be taking those precautions as well.
Brad, you see a lot of businesses with signs at the front door saying if you've been sick, if you've been in a foreign country that's at risk, you shouldn't be walking into these premises. That's one line of defence for these personal services, isn't it?
Yeah, and we can't use our keep cups anymore. We have to use disposable cups now at our cafe shops. So there's a lot of changes that are going on in businesses, and I think we're still trying to have people participating in business. We're still wanting that economy to keep on running as best as we can. I suppose down the track we may actually say, look, just don't get out of your house. Over initially they have had like just going to the supermarket or the pharmacy and that's it. So people have been Googling online at how to cut my own damn hair.
I've been doing that.
Have you? Have you been cutting your own hair or Googling?
Both. Well, I haven't cut my own hair yet, but I am kind of daydreaming about the buzz cut to come because I'm not quite sure how this is going to work. I mean, there's a significant degree of exposure for those people who are working, and you know, it's a stream of income for them. It's a very big call to say,
don't do it.
Don't do your massage. Don't do your haircuts. Yeah.
So one thing I did want to flag, and I don't know if we've had any questions, is just about the impact of this virus on young people. I think there's been some good new data that's come out in the last week. It was data looking at patients from the United States, 2,500 people in the United States that had coronavirus. And I live in a household full of uni students, and I was just wanting to flag with them this data showing that it was nearly 40% of people who were hospitalised in the US were aged between 20 and 54. So almost half were under the age of 55. And, you know, young people, they might not get sick, but they're still ending up in hospital. So it's not necessarily always a mild illness for the younger cohorts.
I'm really glad you mentioned that, because later in this live stream we're going to be speaking to a clinical psychologist just about sort of your mental fitness. It's not so much about, you know, just dealing with things like depression or anxiety during this very difficult time, but just keeping yourself mentally fit, particularly when you're social distancing. And on that note, let's keep going with this question of social distancing. I'm age 77, someone writes. Is it okay for me to mix with one family member at a time even though they have to mix with others, for instance, going to work. So by extension, you're exposed to a much broader group of people than it might seem. And someone else asks, I understand self-isolation, but what about those of us who are practicing social distancing? Can I go for a hike with 1 friend, 4 friends, 10 friends? Brad, what does that look like?
Yeah, I think one of the things to really mention is the seriousness of this. And I think there are many young people who are in their 20s or younger who are just like, oh, well, this isn't going to affect me. This isn't a problem. And if we have that attitude, this is really going to get out of hand very quickly. So I think if you are going for exercising, if you're exercising with other household members, I think they'll be okay. If you did happen to go for a run with somebody like a friend who's down the road, trying to keep that physical distance of at least 1.5 metres as you are exercising. If you're crossing past somebody on the pavement, we are needing to divert and to go with a wide berth from other people. And the whole thing is that, as Sophie said, you may get sick, you may not die, but you could be in intensive care for weeks. So this is a problem, and you could certainly transmit the virus to somebody else in the household, and they could die or get into hospital as well. So we need to be stopping having parties. We need to stop meeting up in cafes and restaurants as much as we can, and we're needing to take this very seriously.
And Norman Swan on the latest CoronaCast podcast also saying, not that it probably needs to be said, but casual sex, that's one of the things. It's out.
So how are the dating apps dealing with this, I wonder?
I have
I'm not
read
on any,
that,
so I don't know.
No, neither am I, but I have read that some of them are kind of issuing the warnings right up front and saying just be really careful. I think they do that anyway.
But I guess you need to be super cautious.
Yeah. Let's go to Bret Gilbert, who's written to us on the YouTube channel. Bret, thank you for watching. Bret says, should not the public messaging be that everyone should be social distancing / isolating to their greatest reasonable capacity rather than just doing the minimum that the government is recommending? And we've seen this week this kind of, the numbers change, 500 and then it's down to, kind of lower numbers than that and in different contexts as well. But the whole heap of exceptions, things like public transports and schools, for instance. Brad, this is something that we all really need to keep on top of.
Yeah, well, this is the interesting thing with Scott Morrison announcing today that we should be socially distancing. We need to have like a 4x4? No, 4 metre squared, 2 by 2 metres around us space when we're meeting up. But then that rule doesn't apply at schools or educational areas. So I'm wondering, why this is the case. If we're told to separate as much as possible, we're still keeping the schools open. This is a real difficulty. I think telling kids to keep 2 metres away from each other probably isn't going to work very well. So yeah, it is a big question about whether to close down the schools. And I think a lot of medics have been quite clear on that.
I got a direct message from a viewer this week, Sophie, talking about how difficult it is to do just that, what Brad was just saying in the school playground.
It would be almost impossible, I would imagine.
Yeah.
Look, I think it's inevitable we will see some schools close in the future. I certainly know a lot of the private schools and independent schools
and they're doing
have
that
gone to
voluntarily.
Online learning. Yeah, they've gone to online learning. Most of, if not all of the universities have gone to online learning. I think the thing about what we're dealing with is you need to be able to do as much as you can as an individual to minimise your risk. So if you can stay at home, if you can work from home, like a lot of the people in the ABC are now working from home. It's a brand new world, but it means we're all taking as much action individually as we can to stop mixing with people, to stop doing things that we would like to do, but for the greater good. That if you look at the data of the countries where they've had good social distancing versus not good social distancing, it's made a huge difference. And we're in a really, really important window. I keep saying to the kids, it's not going to be like this forever, but for the next little while, we've all got to make a big effort.
Brad, when you say that as a medical, as a doctor, and you see patients, and I'm sure you're getting a million questions from people just in your life, are people able to grasp the magnitude of how much this changes their lives? Because I've certainly found that the people I talk to, it's really hard to get your head around. Yeah,
I really don't think that we understand what we're about to get into. And I've been watching some videos from Italy and seeing what the people have been saying there. And people are horrified. This is like living in a movie. And I don't think people understand the enormity of the issue that we're dealing with here. So I have patients who are now saying, oh, well, I'm needing to get back to Tasmania because they're about to close the borders. So that happened at midnight last night. I've got some patients saying that they're wanting to go to the country because they're less likely to get it compared to being in metropolitan Sydney, for example. So people are sort of making some steps, but I think that's mainly older people and people with chronic medical conditions. They understand the enormity of it. But if you're under the age of 50, you probably haven't quite grasped the subject yet.
Sophie, where are we on that curve? We talk about flattening the curve. This term has been around now for at least a couple of weeks.
That's right.
Where are we on that curve?
Well, we heard Scott Morrison say the measures that they're putting in place are all about flattening the curve. The reality is the curve's still going up in Australia, but that's because largely the measures that were taken will not see the impact probably until next week. So we're still going up. If you look at the figures that are widely available, we're definitely going up and up. But the hope is that all the measures that have been put in place and continue to be increased will flatten that curve. And the idea with flattening the curve is really just to slow the spread of the disease and the transmission in the community so that if people do get sick, the hospitals can cope with it. There's enough resources, enough beds, enough ICU beds. And the countries, again, that have been able to flatten the curve have made a huge difference. And we're in that window, we're in that flattening the curve window right now.
Dr. Brad, a question to you from James Stewart, who's just written in saying, does Dr. Brad recommend we stop going to the gym? I have to be honest, from a mental health point of view, the gym is one of my favourite places to go. Is that just a really bad idea?
Yes. So, I hate to say it, but I think that gyms are a situation where people will use equipment, our fingers go on everything, we can wipe down the equipment beforehand and after we train. I think that's a way of limiting the viral spread. But we've seen overseas that gyms have been a great source of infection, particularly in China, sort of spreading the virus from person to person. You often have a lot of young people who may not know that they've got the infection. They'll be sporty and healthy and they'll be getting through that cold fine, but you may not be that person. So I think it is, I hate to say it, but yeah, I would be thinking twice before entering the gym at this point of time.
Gabrielle Maranchi, I think. I'm sorry if I've mispronounced that, Gabrielle. Thank you for watching. Gabrielle asks, can you have COVID-19 without fever, but with a chest complaint and a dry cough? The symptoms obviously vary a little bit, don't they, between patients. Brad, what are you seeing about the sort of the prevalence of certain symptoms over others?
Well, we're only testing people who have symptoms. So there are many people who will already have it in Australia and we just don't know. So we've been hearing stories and seeing some people who have very mild symptoms. So they might have like a mild runny nose, a bit of a cough, a little bit of a sore throat. They're just doing the right thing because they've come back from America, for example, or from Italy. So we are swabbing them and some of these people are coming back positive for COVID-19. Other people have just got the flu and we're sort of like been testing all sorts of respiratory viruses, which have been coming up with influenza or human metapneumovirus, all these weird and wacky things that we don't really care about all that much at this point of time. And we've actually been asked I talked to the pathology lab today, and they were saying that we're really not wanting to test for anything else. They just want us to concentrate on coronavirus completely. So we're not going to check for any of the other viruses. They're just going to be limiting their testing because they are overrun at present.
Sophie?
Yeah, that's interesting, particularly. I mean, if you're in those patients that Brad just described, they'd come back from overseas. Some of the symptoms, we did a story for ABC about a week or so ago, looking at all the symptoms at the WHO and going to look at all the data. And fever was very, very common, if not present in pretty much every patient. So depending on that person's travel history, if they've been overseas, that would put them in a higher risk. Fever, dry cough, fatigue. Some accounts now of people in Australia who've had it and recovered and hearing about how sick they really felt. So, it's going to be individual. I've also spoken to a doctor who said that she'd had a few patients come in with a fever, but also with abdominal issues as well. And it was only when they did a CT scan that they looked at their lungs and they went, oh, wait a minute, this is not abdominal.
And is it right, both of you, that it takes some time for the disease to kind of get really bad? So you may be showing symptoms and you may be okay for about a week and then you rapidly go downhill. Sophie, we had a story on ABC News Online this week of a a lady who's recovered, saying it took about 8 days for her to feel really rotten
again. Yeah, well, like the virus can become visible at about 6 days, but it can take a while to play out, and then it can take, in the research we've looked at, up to 20 days to fully get the virus out of your system. So this is something that's not just like feeling crappy for a day or two. It's quite a while. And Brad, would that be what your patients are saying?
Yeah, so from exposure to infection, the average is about 5 to 6 days until people start to get symptoms, and then it can be very variable. So if you're getting up to like 9 or 10 days of the illness, that's when you could actually just drop your bundle and get very sick very, very quickly. And so in hospitals, they're sort of seeing people coming in, they're a little bit breathless, and then they're a little bit edgy while they're waiting for the results to come back, and then people can crash and they need to be on oxygen and have ventilation quite quickly. So this is what we're seeing and what medics are really worried about at this point.
Okay, Brad, a question from Reese Philby on Facebook. Reese asks the question, is everyone eventually going to catch this? Should I still book in for my annual flu shot?
You should definitely book in for your annual flu shot. So a lot of clinics around are just offering flu, or they will be offering flu clinics where you can sort of come in, get your injection and get out of there, because we don't want you waiting in the waiting room with lots of other people for long periods of time. So you'll probably see those announcements. So look out for that at your local clinic. Hopefully that's getting rolled out as we get flu vaccinations. But yeah, like eventually everybody will get the virus unless we actually have a vaccine for it. So we're working hard on that. We are estimating, initial estimates in Australia were saying that about 20% of the population were going to get it. Recent estimates are saying about 40% of the population will get it in the next 12 months. And some countries are estimating even 50 to 70% plus. So it's anybody's guess at this point of time. We've only seen the virus for three or 4 months now. So we don't know what's going to happen. We hope for the best and prepare for the worst.
That sounds like good advice. And that, again, is why social distancing is so important. If it is going to become really common in the community and having that community transmission, the more we can keep to ourselves and isolate ourselves, even just for the short term, we're less likely to get it.
Now, on that question of isolation, as I promised, we want to bring in a clinical psychologist now, Dr. Carly Jonko. She's here to answer your questions, not only about strategies to deal with isolation, but how you can contextualise the sheer amount of daunting information that we're all being flooded with right now. Dr. Jonko, welcome to the program. Thank you so much for joining us.
Thank you for having me.
Are you sort of seeing people presenting with sort of more concerns, anxieties, sort of depression maybe, just elevated at this time?
Yeah, I mean, there's obviously quite different reactions people are having at the moment. We're ranging right from people who are not concerned at all or perhaps are dismissive of the situation through to people who are very concerned and very panicked, and this is having a very profound impact on their life. And I guess in this situation, what we're seeing is people's experience of uncertainty. There's a lot of risk in our daily life. When we cross the road or we drive our car, there's a certain element of risk present in that. But the difference really in those situations is that we understand the level of risk, and we know that there are things that we can personally do to mitigate that type of risk. And what we're seeing in this current environment is a lot of uncertainty. People don't understand the illness. They don't understand how this is going to play out. And when people are faced with uncertainty, we do have a tendency to think a bit more catastrophically and to overestimate perhaps the likelihood that terrible outcomes will eventuate or how catastrophic those might be for us.
In that context, is there some usefulness for people being so scared as to change the way they act day to day, that being just a little bit of fear maybe makes them take it a bit more seriously than they otherwise would?
Yeah, I guess the key message really would be to take this pandemic seriously and take reasonable precautions, but also to keep our responses in perspective. That often when we're feeling very anxious or very panicked, we can tend to take much more extreme we can engage in much more extreme behaviours, and that's where we've seen some of this panic buying or some of these real panic responses from people. And so I guess we would encourage people to be staying informed and to keep their responses in perspective perspective, given the current recommendations as well. So a little bit of anxiety is actually motivating for us to engage in, to protect ourselves and to protect those people around us. But too much is actually problematic. So you kind of want to be in that happy middle zone.
It's really quite hard to see where the sweet spot might be. Sophie, you've written extensively about mental health. How are you seeing it playing out in the community, and what's the best advice you can give about keeping things in perspective?
I think the best thing is to think about, we've had a lot of change in the last couple of weeks, to think about the things that are constant. You know, our relationships with the people we love are constant. I had to have a bit of a mental health break yesterday. I thought I needed to just get away from that, like you talked about, that flow of information is just overwhelming. So I just took my dog for a walk at the beach, you know, just away from other people, but just having that little sort of step back from and going, you know what, the beach is still here, the sand's here, the sun's out, and focusing on the things that are constant. I think is helpful. And then also doing things like, it's very simple, but even just doing breathing exercises to slow the rate of your breathing, to bring your whole central nervous system down and help you get out of that really panicked anxiety phase that we've been hearing about.
Dr. Brad, do you have any particular strategies that you like to employ when you're sort of dealing with the sheer scale of what you particularly see as a health worker?
Yeah, I think when I'm at work and I'm just talking to people constantly about coronavirus and trying to answer as many questions as possible, I'll finish at the office and then walk outside and looking at the sunlight and breathing the fresh air outside. It's sort of like a great reminder that we're still plodding along, like things are still going ahead, and we're needing those reminders. And that's why we were talking about exercise before. It's so important for your mental health. So you're needing to get into a routine with that, either doing exercise at home or else, going down to the beach or to the park where there aren't any other people that are rubbing shoulders with you. That's really, really important. Calling your neighbour, calling your family, your friends, dropping notes into your neighbours' doors as long as you're not giving them coronavirus on the paper, and making sure that they've got somebody who's looking out for them as well. We're needing to do this as a community.
Dr. Jonko, one of the issues with isolation or social distancing is that it's really, I'm finding, not that easy to just maintain the sorts of connections that you would normally be accustomed to. So FaceTiming, as I've been FaceTiming that many people this week, and it's just not the same from a social connection point of view. Do you have any strategies for sort of breaking that sort of that invisible barrier?
Yeah, I guess these are times where we do have to be a little bit creative, and we potentially have to also make do with what we can get. That we are in these new times, and we won't necessarily have these perfect solutions as much as we would love life to have gone in exactly the way it was before. We do have to think a bit creatively, and we do have to, in some ways, make some adjustments, and they will be most difficult in these early phases when we're all just learning how to make these adjustments and how to communicate effectively when that's virtual, which is obviously a bit different to those face-to-face interactions. But I guess a very important message would be, just because it's difficult, don't give up. That the more we practice, the more we keep doing these things, the easier it will become. And if we find that because it's not the same, we stop doing it, that actually is going to leave us feeling very isolated, particularly given we don't know how long this will continue for.
Sophie, I've seen a number of people doing work drinks over video conference.
Whatever it takes.
Whatever it takes. But as someone who's been working from home, what is it like? I mean, do you have any particular tips about how you structure your day?
Yeah, look,
because you can kind of the day just disappears.
I try to think about it like a normal day. My husband and one of my sons are working from home as well. And another son, he works for Apple, and they've been given 2 weeks off paid. So the house is pretty crowded, but I'm trying to structure it as much as I can as a normal work day. So have breakfast, get in your work clothes. I've got my computer set up in the kitchen, make the calls. We're doing a lot of Zoom calls where you can keep your pet on your lap. So everyone's been taking their pets and putting them on the Zoom call. So, we're trying to make the best of the situation. And then breaking for lunch, just like you normally would, and then clocking off just like you normally would. I think the temptation just to stay in your active wear all day can be a bit overwhelming, but the more you can put routine and structure in, I think you can grab a little bit of that control back. And then hopefully you'll feel as productive as you would if you were sitting at your desk.
Dr. Brad, we're getting a lot of questions about how to deal with children who ask a lot of questions about coronavirus and not catastrophising what's going on right now. What's your view?
It's really using age-appropriate language for your child, and you don't need to explain everything about what's going on, but do talk to them in very simple ways. Give them routines that they can use. So some schools are putting stamps on people's hands and then challenging them to wash it off by the end of the day. So there are little games that you can play with kids, and with some really good lessons behind it and some good practices. So yeah, don't scare them too much. And as the psychologist was saying, a little bit of anxiety is okay, but not too much, that you're stealing everybody's toilet paper.
Dr. Carly Jonko, any particular strategies for dealing with children, and perhaps even the elderly as well, those who may be in care and don't really understand the magnitude of what's going on in the wider world?
Yeah, I guess in very similar terms, speaking in an age-appropriate way and sharing information that's critical, that for both of those age groups, we need to understand how much they already know about the illness, and potentially correct some misunderstandings, particularly for older children or teenagers, and older adults as well, who may have seen media exposure or seen people wearing masks. They certainly will be aware of an increased push for good hygiene practices. So allowing them to talk about their concerns and really validating those fears, that it's natural for a lot of us to have some concerns at the moment, but also being, I guess, forearmed with accurate information from reliable sources. So being able to, for example, reassure children that children actually seem to be one of the least vulnerable groups in terms of infection. And that even amongst older adults, that it's still quite a small proportion of older people who will have serious symptoms or potentially very negative outcomes. So a little bit of reassurance can go a long way, but then also really trying to help them to think about what they can personally do. So giving people that sense of agency and empowerment, even in these circumstances that are a bit more uncertain. What is it that they can be doing to both protect themselves and to protect people around them?
All right, Dr. Carly Jonko, Sophie Scott, Dr. Brad Mckay, thank you all for being here with us on this live stream today. Thank you to all of you who've written in, those who've watched and asked some really, really excellent questions. As Dr. Jonko mentioned, it's really important to stay up to date with the latest information, and that information, the advice that we're receiving from medical experts and from the government, is changing rapidly. So it's really important to stay on top of it, try not to be overwhelmed by it. And we're going to be continuing to endeavour to bring you the very latest information right here on the ABC on all our platforms. The latest information on the special coverage page of the ABC News website. That's at abc.net.au/coronavirus. What else? Thank you for joining us. We'll be back live here for another live stream next week. And also don't forget to catch our show at 7:45 Eastern Time tonight, The Virus. From all of us for now, goodbye.